video to get yes to get a strong network signal, and I would request Joel to give me any alert in case of some inconvenience, including sound breaks, slide not moving, and so on and so on. So thanks. So as Joel has introduced me already, my name is Emmanuel Bajober, and I work at APHRC as a research scientist with a focus on maternal, newborn, and child health and maternal mental health. And of course, I used to work in university setups as a lecturer and a researcher in Africa and beyond. And of course, I've published and cited and affiliated to many institutes, including Addis Ababa University, Hawassa University, the University of Queensland in Australia, and Harvard Medical School, among others. And I'm very enthusiastic and, of course, published some papers, especially on mental health in the context of adverse childhood experiences and adverse pregnancy outcomes. So that is who I am, very shortly. And just to declare if there is any conflict of interest, honestly, I don't have any conflict of interest to declare. But as I've said already, I'm a full-time staff at APHRC, and my presentation today is part of my contribution for my current role. And I've used different references and components of some slide decks. I've borrowed and contextualized from my previous training on the topic by different institutions, including but not limited to WHO, Harvard Medical School, but all are duly cited. And of course, we are talking science, and implementation science or implementation research is a cross-cutting discipline across all research fields. So except that we are contextualizing some aspects to mental health real scenarios, the concepts are cross-cutting and not exclusive to mental health research. And of course, that is very understandable. And regarding expectations, I expect that our audiences have some fundamental background. Of course, I can also see senior names so far in research and different research methodologies with relevant undergrad and postgrad qualifications. So in some instances, we will not go into some details as I try to avoid unnecessary clutter. So more or less will follow adult learning principles. So yeah, those are generally my expectations. Regarding the course, so the course on implementation research in mental health would explore the fundamentals of implementation science. It will introduce strategies for using innovative scientific methods and tools as is relevant to mental health. And we will also try to see how it could be applied using case studies to identify and contextualize implementation successes and failures in the context of mental health. Of course, I'm allowed to speak for 3 hours, but I won't take more than 2 hours at max. Obviously, you are also given 4 weeks for your, self-paced study. And of course, we will also be giving references relevant to this lecture so that you dig deeper for the next 4 weeks. So these are the course contents, as you can see online from the course outline. So we'll be dealing with fundamental of implementation research, types of implementation research, implementation research design for mental health. And of course, we'll also see evidence translation, dissemination, and scaling up of mental health interventions. And we'll highlight also economics of mental health very briefly. So these are the course objectives. As you can see, at the end, you are expected, or we are expected to achieve some of this or all of these objectives, one of which is identifying appropriate intervention or intervention to translate into practice. Once again, in the context of mental health, design effective and sustainable implementation strategies, as well as design comprehensive evaluations of intervention implementation strategies to overcome shortcomings to implementation and facilitate timely scale-up of proven interventions with high levels of fidelity as well as effectiveness. And we would also expect you to identify major factors that may limit translation of evidence into effective programs, and describe the role of complementary implementation science research methods in development of evidence-based practices and policies. And of course, you would also able to describe frameworks for designing successful implementation strategies and apply some of the relevant frameworks in your real context. So what we'll be looking on elementary aspects or concepts of implementation research. And I think this scenario would give you some highlights about what we'll be talking in the next couple of minutes or hours. So just look at it, take a minute on this slide. So, or I can redirect it to you. So it says lost in translation, developing the science of implementation. So a 19-year-old adolescent was brought to a given clinic by parents due to concerns about changes in mood and behavior, and reported feeling sad, hopelessness, unmotivated for the past months, and had difficulty sleeping and experiences significant changes in appetite, leading to weight loss, and also expressed feelings of worthlessness and guilt, and had trouble concentrating on schoolwork, and withdrew from social activities, and no longer enjoyed hobbies they used to love. So this individual had been diagnosed with depression 2 years ago and had been prescribed oral medications. And otherwise, that individual was healthy. And the routine physical examination and lab works reveal no significant anomalies or abnormalities apart from the said symptoms. And that individual was subjected to be treated with some oral medications and supported by professional counseling on adherence of the medications. So the question is that what factors may have contributed to the onset of these symptoms, given that the patient was already diagnosed with depression and had been in treatment for the last several years. And other related question would be, how can we support the adolescent in managing his or her depression and improving the overall well-being? Well-being. So I think this case scenario would give you some hints, and of course this question would also make some thinking regarding what was lost in translation, given there is effective and of course efficacious medications for that case, that is for depression. So now the main thing we would think for this case would be adherence to medications, and that leads to for the onset of the symptoms for the already diagnosed case, which had been or who had been on medication for the last 2 years. So as we think of the previous questions, I think from our elementary lectures on behavioral science or on health service management, the health belief model would give you or would give us some clues why that individual was not adhering to the medications for his or her depression. So obviously, a given action would depend on the perceived susceptibility or perceived severity of a given condition for that particular individual. that would lead for perceived threat, and of course, which would mimic also cues to action. And of course, in turn, this would be modified by many factors like individual level factors, even system level factors that would affect or modify the perceived trait of that individual for a given condition based on their perception on susceptibility and severity, which finally would lead to the likelihood of a given behavior, that is obviously the non-adherence of that medication. And that would obviously be perceived benefit minus perceived barriers, leading, as a function of likelihood of actions. So in that regard, of course, we would consider non-adherence to a medication with many interrelated and interacting functions. And one of which will be related to a patient-related factor. The other would be clinician-related factor, and the other should be health system-related factor, interacting together for non-adherence of an individual. And this can be leading for that individual for the non-adherence and ultimately for the onset of those symptoms. So as you can see, there is provider-patient communication, which would be leading for, poor patient understanding of the disease, poor understanding of risk and benefit of treatment, and poor understanding of use of the medication and others. And of course, patient interaction with the healthcare system would be also other factor. And of course, physicians' interaction with the healthcare system would also be another factor, but all in a given ecosystem are interacting and leading that individual for non-medication of, non-adherence for those medications. And of course, as one of these functions, it could also be related to complex dosing regimens, which likely relates to multiple factors like forgetfulness, treatment, and illness perceptions, drug interaction or side effects, and so on. And of course, this is a publication in a New England Journal of Medicine quite some years back, indicating that complex dosing regimens are also contributing factors for non-adherence. And as we have said, health systems complexity is another factor interacting, of course, affecting all interactions in an ecology of patient provider and patient healthcare system interaction. So every additional pharmacy that patient visits, for example, reduce adherence by 2%, and making multiple trips to the pharmacy to pick up prescriptions reduces adherence by 8%, as compared to patients whose visits are most consolidated. So, of course, non-adherence would also relate to pill appearance as well. So these are some of the factors that we could consider with non-adherence of that patient or that individual to the effective antipsychotic or antidepressive medications where they had been for the last couple of years, contributing for the onset of those symptoms. So now, if we give that case scenario, in case, for you mimicking your understanding or brainstorming your understanding and leading to the 2 days session, that is implementation science versus implementation research. What do we mean by implementation science and research, and how could it contribute to, for example, the previous scenario, non-adherence to medications and contributing for the onset of the symptoms? And of course, despite there were effective treatment for the case. So in that case, I will be talking about implementation science a little bit and leading to implementation research in detail. So implementation science is the method, the study of methods and strategies to promote the uptake of evidence-based practices or interventions and policies into regular use within real-world settings. Real-world setting, in essence, healthcare such as healthcare systems, public health, education, and so on. So its goal is to bridge the gap between research findings and the practical application to improve outcomes and enhance the quality of services. So the key concepts here are evidence-based practice. So evidence-based practices are interventions or strategies or practices that have been proven effective through meticulous research and evaluation. And implementation strategies should also be the core concept of implementation science, which may include methods used to support the adoption, integration, and sustainability of effective evidence-based practices in specific settings. For example, trainings, technical assistance, policy change, and incentives. Another concept related to implementation science is context and setting. This is a critical element in implementation science, recognizing the unique characteristics of the environment where implementation occurs, such as organizational culture, resources, and stakeholder engagement. Another context, obviously, and of course, which is at the center of implementation science is also stakeholder involvement. Engaging key individuals and groups who are affected by or can influence the implementation process, including practitioners, policymakers, patients, and the community members, and even as researchers. So this is another concept that is part and parcel of implementation science. And another core concept is, of course, evaluation and measurement, and assessing the effectiveness of implementation strategies and the fidelity of evidence-based practice delivery should be part and parcel of implementation science and is important component of implementation science. And this involves monitoring outcomes, monitoring process, as well as monitoring contextual factors. With this concept, of course, implementation science has established a corpus of research methodologies to evaluate, to test, as well as understand implementation of evidence-based practices. And of course, shifting from can we make it work to how can we best make it work, all right? Kindly try to remember the previous case scenario. So greater emphasis in implementation science is on optimizing implementation strategies that alone or in combination achieve crucial implementation outcomes more rapidly, more cost effectively, and acceptably to deliver systems or agents and to mental health intervention and related morbidities or comorbidities. So that is the current state of the science or the implementation science, especially in the context of the real world setup. So if that is implementation science, what does implementation research mean? Which of course is the reason why we are gathering this afternoon together to share some key elements and of course key concepts so that we familiarize ourselves and we exercise and practice in our real life. So implementation research is the scientific study of methods to promote the systemic or systematic uptake of clinical research findings and other evidence-based practices into routine practice, and hence to improve the quality, which may include the effectiveness, reliability, safety, appropriateness, equity, and efficiency of a given healthcare. So in this concept, there is implementation or there is practice, that is the act of carrying an intervention, an intention into effect, which in healthcare can be policies, programs, or individual practices, which we collectively call them interventions. For example, in the mental health care scenario, the act of providing cognitive behavioral therapy for adolescents with depression could be implementation or practice, whereas implementation research is scientific inquiry into questions concerning implementation. For example, in this case scenario, in this example, studying on the effectiveness of implementing cognitive-based therapy in school settings for adolescents with depression could be implementation research or the application of implementation research. So what would be the difference between or the overlaps between implementation science and implementation research? So there are differences in terms of the scope and the focus, as well as there are also overlaps. So as we have said, implementation research is a subset of implementation science. It involves conducting systematic studies to develop and evaluate the methods and strategies used to implement evidence-based practices. And the goal is to generate knowledge about what works, for whom it works, and under what circumstances it works to improve the effectiveness and efficiency of implementation efforts. So the key difference here in terms of scope is that implementation science is broader in scope, encompassing the entire field, including theoretical frameworks, methods, strategies, and the practical applications. And whereas implementation research focuses specifically on conducting research to test and refine methods and strategies for implementation. In terms of focus, implementation science may include practical aspects of implementation, such as the development of tools and guidelines and the application of findings to improve practice, whereas implementation research primarily is concerned with generating empirical evidence and advancing theoretical understanding of implementation process. And for example, in case of implementation science, a given healthcare organization is working on a large-scale project to improve the uptake of a new mental health treatment, policy guidelines, and protocol. And Ministry of Health of that particular country uses existing research, develop strategies tailored to their context, train staff, monitor the implementation process, and make adjustments based on ongoing feedback. So this entire process falls under implementation science, whereas within the same project, a specific study is conducted to compare the effectiveness of two different training methods for healthcare workers on the new mental health treatment protocol. So the study measures outcomes such as knowledge retention, may measure adherence to the protocol, and mental health care uptake rates among the clients. So this study is an example of implementation research, which is narrower in focus, as well as in scope as compared to implementation science or as compared to the previous example. So the key concept or components that are overlapping in implementation science as well as in implementation research are: one is frameworks and models. So both fields use frameworks like consolidated framework for implementation research and the diffusion of innovation theory to guide their work. And this is one aspect of the overlap. And of course, both implementation research and implementation science also use strategies. So common strategies may include stakeholder engagement, training and education, policy changes, and use of implementation facilitators. And another overriding concept or component for both is outcomes. So both fields aim to improve implementation outcomes, such as adoption, fidelity, sustainability, and scale up of evidence-based practices that we'll be talking later in detail. So basically, these are the differences and the overlaps in terms of scope as well as focus and overriding concepts between implementation science and implementation research for your basic understanding. So the basic concept lies here. So implementation research helps narrow the know-do gaps, all right? There are things we know very well, but there is an actual gap in practice or in effectiveness of that intervention for the for the expected outcomes. So that is when the implementation research come to bridge this gap. So there is effective policy, effective program, effective intervention. However, that policy, that program, and the intent, intervention is not leading to the intended outcome. So that means there is a problem in implementation, and that implementation problem needs to be solved by implementation research and the finding coming from implementation research. So basically, the implementation research and its findings bridge this critical gap in what we do and in what we know. Excellent. So from maybe your basic biomedical or clinical or whatsoever sciences, efficacy may seem as implementation effectiveness. However, in the field of implementation research, efficacy doesn't necessarily mean implementation effectiveness. As we have discussed already, there is very effective or efficacious intervention. However, there is implementation problem, which is leading for under desired outcome that is expected from that intervention. So we need a solution. So that solution for that problem is implementation research and is finding. And in other words, efficacious or effective intervention and implementation effectiveness in an ideal scenario would lead to improved health outcomes under real life conditions. In that case, there is no implementation problem. So we are okay with that. And however, if there is any gap, we solve that gap via implementation research. So what does, if efficacy is not implementation effectiveness, it would be nice if we see the difference between three overriding terms. One is intervention efficacy. So intervention efficacy is the effect of an intervention under controlled settings, all right? Whereas intervention effectiveness is the effect of an intervention in real world settings. This is the difference. And interestingly, implementation effectiveness is the effect of efforts, which may include strategies to deliver an effective intervention in new settings other than where it was previously tested for effectiveness, and or within broader populations under real-world conditions. Such efforts include getting the effective intervention adopted, sustained, as well as scaled up. So these are the interesting concepts as it comes to efficacy and implementation effectiveness in the context of implementation research. Let's consider this research question as we try to differentiate these terms in the context of implementation research. For instance, does integrating, what types of problems does implementation research seek to address, all right? So, for instance, does integrating mental health screening into primary healthcare settings improve access to treatment and outcome for individuals with mental health disorders? So, for example, our healthcare intervention would be integrating mental health screening into primary healthcare settings. And the question, the implementation research question in this context should be, or would be, does integrating mental health screening into primary healthcare settings improve access to treatment and outcomes for individuals with mental health disorders? So the overall goal of this research question is to see the efficacy of integrating mental health screening into primary healthcare setting. And we may use the text as a framework for answering or for contextualizing this research question as we try, this research question as we try to answer the healthcare intervention that is integrating mental health screening into the primary health care. So text as a framework in the context of implementation research is that text is refers to the qualitative data gathered through various methods, such as interviews, focus groups, or open-ended survey responses. Analyzing these texts helps researchers understand the perspectives, experiences, and the contextual factors that influence the implementation of evidence-based practice. Obviously, that is in our context, integrating mental health screening into primary healthcare setting. So in this in the same scenario, evidence-based healthcare intervention here is application of research findings and the clinical guidelines that support the efficacy and effectiveness of mental health screening practices within primary care healthcare environments, such as validated screening tools, training for healthcare providers, integrated care models, and clinical guidelines and protocols to be used in these environments. So our implementation research question would be, what is the impact of integrating mental health screening into primary health care on the early identification and management of mental health conditions, and by extension, how the identification of mental health screening in primary healthcare settings affect patient outcomes, such as the severity of symptoms, quality of life improved, and treatment adherence. So as you can see in this table, the overall goal of this research question, this implementation research question, is to see the effectiveness. And the model can be, behavioral change model as we see fit for our research question. And our topic would be, by extension, on the same research question, would be evidence-based program to increase uptake of evidence-based healthcare intervention. And the example for this should be maybe shared decision-making for integrating mental health screening into primary healthcare settings. And of course, shared decision should be by stakeholders. As we have seen already, stakeholder involvement is at the center of implementation research. So for example, our research question, our implementation research question would be, is electronic and in-person shared decision equally effective? So here we are trying to see or assess implementation, or the goal here is to see the implementation effectiveness using either electronic or in-person shared decision making for the effectiveness of that strategy. So under this context, we may use ecological or process models as we see fit to our real context. So these are some of the defining examples between the previous phrases, which are interrelated, but may necessarily mean different meanings when it comes to implementation research. So why is research on implementation is needed, or why we need, or what's the rationale of implementation research? That's a critical question that, of course, gathered us this afternoon. And of course, a key challenge faced by the local or the global health community is how to take proven interventions and implement them in the real world scenario. And despite abundant evidence, as you know, on the efficacy of affordable life-saving interventions, including for mental health disorders, there is little understanding of how to deliver those interventions effectively in diverse settings and within the wide range of existing health systems. So mental health programs, for example, can significantly improve the quality of life of individuals with severe mental illnesses, but they often fail to reach everyone who needs treatment. That's very obvious. And for example, according to WHO, nearly 2/3 of people with a known mental disorder never seek help from a health professional. And only about 20% of individuals with major depressive disorder receive adequate care globally. And less than 10% of individuals with severe mental health conditions in low-middle income countries receive the necessary treatment. For example, in sub-Saharan African context, in our context, only about 15% of people, 15 of people with depression receive adequate mental health care. In addition, a study published in the Lancet Psychiatry recently indicated that in countries like Nigeria, up to 90% of individuals with mental issues or health issues do not receive any form of mental health treatment due to a lack of resources and trained professionals. So this is one indication that we need to learn and know more about and implement as much as we can in our context in regards to implementation research. And of course, another issue is that implementation research can consider any aspects of implementation, including the factors affecting implementation, the processes of implementation, and the results of implementation, including how to improve potential solutions, introduce potential solutions into a health system, or how to promote their large-scale use and sustainability. So the basic intent of implementation research is to understand not only what is and what is not working, but how and why implementation is going right or wrong, and the testing approaches to improve it. And improved large-scale implementation leading to significantly greater health impact. And of course, evidence-based implementation strategies and agreement on best implementation strategies and improved knowledge and understanding of implementation factors, and filling the existing gap in the research or in the implementation research pipeline is needed, and of course necessitated us to learn implementation research in general and in the mental health context in particular. By extension, implementation issues often arise as a result of contextual factors that policymakers and health system managers may not even have considered. And contribution to implementation research can be made by both people inside and outside academia. And very often it is the person in the field, or that is the physician in the remote rural clinic, or the midwife working in the local community, who facing some particular problem asks the questions that are the starting point for new thinking. So properly conducted implementation research with its all important focus on the context can help implementers foresee and anticipate problems. And it is because of its capacity to illuminate contextual issues that implementation research is such an important tool for implementers at the planning stage. So that also necessitates us to study implementation research and other health outcomes. And implementation research, of course, has great benefits in reducing the gap between what can be achieved in theory and what happens in practice. So implementation research, especially as it relates to low middle-income countries where, despite abundant evidence of the efficacy of affordable life-saving interventions, there is little understanding of how to deliver those interventions effectively. So neglecting those implementation challenges costs us lives and resources, especially in poor resource settings. And implementation research is a relatively new and, of course, somewhat neglected field. And there is a need to define exactly what it is and what it can offer for us. And of course, that also necessitates us to know about implementation research in the context of mental health and beyond. So how is implementation research used? Is our next topic as we exhaust fundamentals of implementation research. So implementation research takes what we know and turns it into what we do. That's the interesting aspect of implementation research. And even when interventions are designed in similar ways, implementation occurs differently in different contexts and with many different effects. So implementation research can offer very critical insights at several levels for implementers who in general recognize that implementation goes beyond simply reapplying the same template in country after country. And implementation research in that sense is very vital to understand the context, assessing performance, informing implementation, and facilitating health systems strengthening. And of course, monitoring and evaluation activities play a significant part in this kind of implementation research, often helping to define important research questions and, of course, urging them to be implemented. And implementation research particularly is important in supporting the scale up of interventions and their integration into health systems at the national or at the large scale level. So too often interventions that work in small scale pilots fail to live up to expectations when rolled out in the national strategies or fail to transfer from one country to another as a result of contextual differences. And implementation research not only helps to clarify why that happens, but can be used to support the process of reiterative refinement needed for successful adaptation. So in this regard, implementation research is important in quality improvement and health system strengthening, and can yield many benefits, but those benefits are maximized where research is answering the questions that decision makers and practitioners are asking or should be asking. So implementation research is or can be used to help organizations develop the capacity to learn. So a key driver of quality improvement and indeed of health system strengthening generally is the learning capacity of organizations. So in that sense, implementation research can be effectively used. So as we try to summarize this subsection, regarding why or how implementation research is used, it would be critical to take some takeaways regarding implementation research and how it can be applied. So it's basically used to assess changes in real world context, drawing up past experiences whenever appropriate, and it's used to understand complex phenomena or phenomenon and generate or test new ideas and predict or at least help anticipate what may happen in the future as a result of particular innovation or change. And it also plays an important role in informing stakeholders, thereby improving understanding, transparency, and accountability. And it offers valuable evidence for healthcare decision makers to assess the effectiveness and shortcomings of healthcare program implementations, and identify and adapt to contextual factors influencing implementation process, and evaluate strategies to ensure the delivery of essential health interventions. So the goal of implementation research is to make a difference, to improve the effectiveness, quality, efficiency, and the equity of policies, programs, and services as relevant to mental health. So as far as these are the basic concepts or fundamentals of implementation research as a subset of implementation science, so how does implementation research differ from other research domains? So for simplicity, we can define or we can categorize research into three: operational research, implementation research, and health systems research. So as we say, we try to see the differences. Operational research basically aims to develop solutions to current operational problems of specific health problems or specific service delivery components of the health system, whereas implementation research aims to develop strategies for available or new health interventions in order to improve access to and use of those interventions by the populations in need. And health systems research is a broader aspect of research that addresses the health system and the policy questions that are not disease specific or health outcome specific, but concern systems problems that have consequences on the performance of the health system as a whole. So these are the basic key differences between different domains of research as opposed to implementation research. And of course, you can see these examples as relates to the three domains of research. So for example, if you consider some mental health related research questions, and which locations, for example, in terms of operational research, which location should be targeted for delivering mental health services in Eastern African region or in Western African region? Here, the examples would be urban slums or rural areas where mental health services are very scarce, and can also involve refugee camps or conflict affected areas where trauma and post-traumatic stress disorder rates are very high. However, the context here is that identifying the regions with the highest prevalence of mental health disorders and considering areas with the least access to mental health care facilities. So those are the basic questions to be answered or could be answered by operational research. However, if we triangulate these two or translate these to implementation research, the question could be, or the research question could be, how can access to mental health services in populations who are currently not reached by these services be improved? So the simple questions in this example could be implementing telemedicine approaches to reach remote areas, or training community health workers to provide basic mental health support services, and and for training community health workers to provide basic mental health support, and the referrals could be the basic questions to be answered by implementation research. So once again, the context matters here. So the context here is developing strategies to overcome barriers such as stigma, maybe lack of awareness, as well as transportation issues that may hinder access to their services. And also it may include training community health workers and provide basic mental health support and referrals. And this could be the basic context that could be answered by implementation research. And when we come to health systems research, sorry, I'm experiencing some visibility issue. Yes. So when we translate the same question or the same context to the health system research, what has been the impact of the rapid scale-up of mental health programs on the fragile health system? This would be the basic question that can be translated from the above questions. And the simple questions here could be increased workload for healthcare providers leading to burnout. And another example could be improved human resource for health outcomes, but challenges in maintaining quality of care due to resource limitation. Once again, the context here is that assessing the strain on existing health infrastructure and personnel, and evaluating the sustainability and integration of mental health services within the broader health system. So these are some of the differentiating examples as relates to implementation research and other domains of research. And in terms of course, I mean, it's simple. The understanding is so very simple, or the concept here. In terms of research users, operational research is, or the findings are mostly used by healthcare providers, and the scope is very narrow. When we come to the implementation research, mostly is used at the program manager level, and is broader than operational one. And when we come to health systems research, the findings or the focus is health system managers or policymakers, and is broader than implementation research. And of course, you can refer those references for further reading. In that context, of course, we are once again refining the differences between implementation research and other research domains. So in terms of the difference, implementation research focuses on implementation as opposed to impact. And it also focuses on complex real-world context as compared to control settings, and is shaped by implementers and stakeholders as opposed to researchers, and is highly practical and action-oriented, and is not theoretical. It uses mixed methods. Of course, we'll come to discuss that in detail, and looks at underlying implementation outcomes, which could include, as opposed to services or outcomes. For example, the focus is on feasibility or fidelity and not on population outcomes. and of course is designed to support policy and practices, and is not afraid of looking at failure and further refinement. So of course, these differences, would lead to the peculiar characteristics that would define implementation research. So implementation research differs from other research in its complexity. So it's multifactorial. Implementation problems are dealt by implementation research. And of course, for that, multidisciplinary and multi-sectoral research approach would be applied. And it could also involve multi-center, multi-country studies for external validity or for generalization in general, for generalizability. And the focus also defines or differentiates implementation research from other types of research. So it focuses on innovation, especially new knowledge and the new solutions. And also it focuses on scaling up and sustainability. And it also differs in terms of the involvement of actors, and actors in a sense here, active involvement of different stakeholders in research design and execution is mandatory, and one of the defining elements of implementation research. As such, lead role of endemic country researchers is at the center of implementation research, and of course, ownership of interventions by end users, including or especially by the community, is at the center, and one of the peculiar characteristics that differentiates implementation research from other types of research. So, all right, let me pause for a few seconds as you process your previous or our previous slide. So now we'll be dealing with the types of implementation research for the next couple of minutes. Okay, how many or what types of implementation research you know? Okay, just have a look at this congested slide. Sorry, it's congested because I tried to bring many aspects into one slide, and I hope it is readable. So basically, as we discuss about the types of implementation research encompasses various types and methodologies aimed at understanding and improving the uptake, implementation, and sustainability of evidence-based interventions. And generally, there are, as you can see from this table, of course, there are about 9 implementation research types, but they may not be mutually exclusive, and many types of implementation research or implementation research methodologies would be used simultaneously in one study. But we'll narrow these study types into 6 implementation research types in upcoming slides that apply to implementation specific research methods, especially with the case scenarios in the mental health context. So anyway, as we try to see the types of implementation research, the purpose and the methods are defining criteria for selecting or for defining the types of implementation research. For example, as you can see the second row, the descriptive implementation research, the overall purpose of or the primary purpose of descriptive implementation research is just description of how the interventions are implemented in real-world settings. And for that, we may use qualitative methods, which may include interviews, focus group discussions, or observations. And coming down to the middle, for example, effectiveness implementation hybrid design, that is the 4th type in the table, as you see. The purpose here is assessing both the effectiveness of the intervention and the implementation process. As such, the methods would include RCTs or randomized control trials, which would be embed implementation evaluations. For example, testing the effectiveness of a digital cognitive behavioral therapy program, while in the meantime or in the same time evaluating the implementation process in the community health setting. So the overall purpose of, the core point here is that as we select or as we try to understand the types of implementation research, the type is derived by the purpose as well as the methods. Excellent. In that case, I just will quickly run or rush into impact evaluation and implementation research designs for mental health. And I know you had a very interesting impact evaluation webinar already, or you would have very soon. So my focus here would be just on implementation research design, which would be very relevant for the mental health context in particular, and in general for other health outcomes. So in this case, I think it would be nice to discuss the rationale why we need mental health related implementation research. Obviously, somehow we have already discussed some rationales in the earlier discussion, but to allude on those related concepts, mental health programmatic scale-up services or service delivery offer many opportunities to improve mental health outcomes through better implementation and integration of evidence-based interventions, no question about that. And that is the center of implementation research in general. And they also provide opportunities to improve other health outcomes, all right? That would be, for example, associated morbidities or comorbidities among those receiving mental health services. And it also would be important to see implementation research opportunities as vis-a-vis mental illnesses, and the big picture would lie within these questions. One of which would be, for a given mental health comorbidity or mental health morbidity or illness, what can be learned from implementation science research that has been conducted outside the mental health setting? That is why I declared that implementation research or implementation science is not specific to mental health. It is a cross-cutting discipline across, and that exchange of learning from other related disciplines is very critical. And in resource-limited settings, especially like ours, what can we learn about screening, diagnosis, and management of mental health morbidities? And that will be relevant to the care of the broader population. And another question, of course, would be implementation science research around screening and management of risk factors for mental health comorbidity, including substance use, abuse, or chronic stress, could result in prevention and or early detection of several mental health conditions, reducing their ultimate burden. And would a better understanding of the preferences of clients or patients, even providers, with respect to a given evidence-based intervention be useful to better inform the design strategies to improve the uptake of uptake engagement as well as delivery? So these questions are at the center, and the key research questions here are: what combination of implementation strategies are necessary and sufficient to increase the impact of, the impact of intervention related morbidities or comorbidities? And given limited resources in a given setup, what implementation strategies will be most effective when implementing interventions for mental health comorbidities at the lowest cost? And how can we learn from our successes and the challenges as we roll out interventions for mental health related illnesses over time to more rapidly achieve implementation? And can the cost and the resources included in a successful multi-component implementation strategy package would be reduced while maintaining its impact? And another question, of course, we would ask is, how can the field begin to optimize, that is implementation research, optimize implementation during the development as well as testing of new intervention or interventions for mental health related morbidities. And these questions are very critical because with recent scientific advances in both biomedical and behavioral interventions, the challenge is delivering these interventions to the right people at the right time, in the right place, via the right way and in the right amount. That is the implementation component. And of course, we are operating in limited resources for implementation that must be used as efficiently as possible to achieve maximum effects. And of course, decision makers need guidance to make informed selections of interventions and the required strategies to implement them based on evidence that can quantify the budget impact, cost benefit, and cost effectiveness. So those are the critical questions that we need to consider while we consider implementation research in the conduct of mental health research. And of course, these are the key steps in conducting implementation research, of course, and other explicit aspects of this slide will be presented in subsequent sessions. So this is an iterative process, as you can see, and engaging representatives of key stakeholders is the beginning of thinking of conducting implementation research. All right, so this engagement of representatives would lead to identification and refinement of implementation problems, and of course ultimately would define research questions, and of course would refine the design and the plan of the implementation research, and of course may directly lead for the collection and analysis of the data, the required data, or it may lead for further engagement in order to refine and redefine the research question that is being considered. And of course, the cycle continues for communicating implementation research findings to stakeholders, and of course, using the evidence to strengthen implementation. And finally, of course, not finally, is an iterative process, but monitoring and evaluation is part and parcel of this condition. And this cycle is a continuous cycle, and continuous stakeholder engagement and involvement is at the heart of implementation research, not specifically to mental health, but other aspects of implementation research as we see fit. So that is critically important to consider. So if you consider this, what approaches and methods are appropriate for implementation research in mental health? And implementation research, like all research, is governed by two broad principles. One is its findings should be warranted. Warranted in essence, it should be supported by efficient evidence, and its methods should be transparent. That means it should be sufficiently explicit for others to be able to judge whether the processes are adequate and justify the conclusions reached and can be repeated. And implementation research draws on a wide variety of qualitative, quantitative, and mixed method research approaches. So it makes little sense to talk in terms of a narrow set of implementation research methods. And these are, however, some research methods that even been developed specifically to deal with implementation research questions, or are particularly suited to implementation research in the context of mental health. And of course, I will be describing them in the upcoming sessions. So as I've said, we generally would have 9 types of implementation research based on the purpose and the scope, but we can narrow them down to 6 types of implementation research, which would start with pragmatic trials, or practical trials, effectiveness implementation hybrid trials, quality improvement studies, participatory action research, that is PAR, and realistic review and mixed method researches. So for the upcoming session, of course, we will complement explanation of these study designs or implementation research methods with real examples from literature, as it's relevant for low middle income country context. Good. So what does pragmatic trial mean, and what does it involve? Generally, pragmatic trial is an RCT or a variety of RCT in which the main research question focuses on effectiveness of an intervention in a normal practice setting, that is in a real world setting, with a full range of study participants. So this may include pragmatic trials on new healthcare delivery strategies, such as integrated chronic care clinics or nurse-run community clinics. As you see fit, you can add more other examples. And it contrasts, unlike with others, or it contrasts with typical RCTs that look at the efficacy of an intervention in an ideal or controlled settings and with highly selected patients and the standard clinical outcomes, usually of a short-term nature, and focuses on the effects of the intervention in routine practice in real-world conditions, whereas explanatory trials generally seek to understand and explain the benefit produced by an intervention under control conditions, often using carefully selected subjects in a research clinic. So these are the basic concepts regarding pragmatic trials or practical trials as one of implementation research, one of the main, of course, implementation research design. So these are the examples of studies that use pragmatic trials on mental health, majorly in low middle income countries. For example, the first study is clinical antipsychotic trials of intervention effectiveness. And this was a pragmatic trial comparing the effectiveness of different antipsychotic medications for patients with chronic schizophrenia. Schizophrenia, as most of you know, is a severe form of mental health disorder, and of course, one of the targets for mental health data prize in our context. And this study was conducted in diverse clinical settings to evaluate how these medications perform in real-world conditions. And the other pragmatic trials in the mental health context is psychosis, risk, and intervention evaluation study. And this study evaluated the effectiveness of cognitive behavioral therapy in preventing psychosis in individuals at clinical high risk for developing psychosis, and was designed to develop pragmatic, reflecting real-world clinical practices. And the third type of, or the third example of the study that used pragmatic trials in the mental health context is multi-site adult ADHD clinical trial. This trial investigated the effectiveness of methylphenidate, which of course is a common medication for ADHD, as most of you know, if most of you are clinician, in treating hyperactivity symptoms in individuals with pervasive developmental disorders, and was designed to provide evidence applicable to clinical practices. So these are the few examples for the first implementation research methodology as relevant to mental health. And the second and the most widely being recognized methodology or method is effectiveness implementation hybrid trial. Honestly, I like this trial. And this is intended to assess the effectiveness of both an intervention and an implementation strategy. Possibly simultaneously in a single study, and include components of an design, for example, randomized allocation to intervention and comparison arms, but at the testing of an implementation strategy, which may also be randomized. This might include testing the effectiveness of a package of delivery and, for example, postnatal care in underserved areas, as well as testing several strategies for providing the care, maybe to neutralize postpartum depression. Whereas pragmatic trial, that is the previous trial, doesn't try to control or ensure the delivery of services to meet a realistic understanding in a normal practice setting. This trial also intervenes and or observes the implementation process at it actually occurs, for example, by assessing implementation outcome variables. So that's really is very fascinating type. And there are, I mean, in general, there are three types of effectiveness implementation hybrid trial. One is called type 1. And type 1 designs or design generally tests the effects of health intervention on relevant outcomes while observing and gathering information on implementation. For example, symptoms in response to a health intervention are measured, while at the same time, the feasibility and acceptability of the implementation approach taken is evaluated. And the type 2 design involves the dual testing of health intervention and implementation strategies. And type 3 design tests an implementation strategy while observing and gathering information on the health intervention's impact on relevant outcomes. So this is the second type. And I really try to allude this type of trial because it's so very relevant in many contexts, especially when it comes to mental health. So the benefits are so many, one of which is effectiveness implementation. I mean, one of which, of course, is, this implementation, effectiveness implementation hybrid trials offer a number of benefits, including speeding up the translation of knowledge into action. So it allows researchers to simultaneously evaluate the impact of interventions introduced in real-world settings and the implementation strategy used to deliver them. And these designs not only speed up what may otherwise be a very time-consuming process, they also allow researchers to identify important intervention implementation interactions. Kindly, note that the simultaneity of intervention as well as implementation in this trial, and this can then be used to inform decisions about optimal implementation approaches. So this really brings the unique nature of implementation research. And these are the few examples using actual case scenarios from most widely cited literature in low middle income country setups that use this trial in general. So the first one, of course, is MANAS. MANAS is the effectiveness of LA healthcare worker intervention for depressive and anxiety disorder in primary healthcare in India. And this, of course, is an RCT, a cluster RCT. And it evaluated the effectiveness of a collaborative stepped care intervention delivered by healthcare workers for individuals with depressive and anxiety disorders in primary care setting. And another example, of course, is a PRIME study, that is Program for Improving Mental Health. And this study was an effectiveness implementation hybrid trial implemented in around 6 low middle income countries, which may include, if I'm not wrong, Ethiopia, India, Nepal, South Africa, Uganda, and Zambia, which aim to integrate mental health services into primary care and evaluate the effectiveness of this integrated approach while considering implementation challenges and system reforms. And those are very pertinent examples for the second type of study, implementation research methodology type. And at this very point, as I've said, I'm very excited of this design. And honestly, we have a very exciting and ambitious proposal at APHRC, which I lead currently, which we are looking for potential funder to implement in urban slum setups for perinatal depression to improve maternal, newborn, and the childhood outcomes, or basically as a secondary outcomes and primarily perinatal depression outcomes in young and adolescent mothers. So if one of you or, you are from a funding organization and very interested in such a design, kindly reach out to us and fund our study so that we make also our own path and make an impact. So that's a kind of advert that I would like to bring here using this opportunity. Anyway, let's move to the third type. So the third type obviously is quality improvement studies. And this typically involves a set of structured cyclical processes governed by a paradigm referred to as the plan to, the plan do steady act. As most of you know or may know, PDSA cycle, or it is variant. We can see here, yeah. So this one. So this variant considers the PDSA cycle, and as we plan for changes to bring about improvement via implementation research, we also do changes on a small scale, first to trial them, and then we study changes to see if they are working and investigate selected processes, and we act to get the or to get the greatest benefit from changes, and the cycle continues. So this is interesting aspect of quality improvement study, and the PDSA cycle allows for the application of scientific methods on a continuous basis to formulate a hypothesis or plan to improve quality, implement the plan, analyze and interpret the results, then generate a plan for what to do next. So that is at the center of the PDSA cycle for quality improvement. And for example, what you can see the example, that is whether or what the most effective strategies for reducing patient waiting times for mental health consultations in primary healthcare settings, and how do these settings impact the overall quality of mental health care provided. So PDSA studies are often referred to as quasi-experimental because the experimental or the researcher lacks complete control of the study. And of course, you can browse the guideline provided to see more about quality improvement studies and the guidelines. And these are the examples from literature as they are relevant to our webinar today. So one of the study is called Emerald. So this is evaluating mental health and illness in low middle income countries. Which of course as a program included quality improvement studies aimed at evaluating and improving mental health systems in 6 low and middle income countries that I mentioned earlier, including Uganda, Ethiopia, Zambia, Nigeria, South Africa, from Africa, and India, and I think Nepal from Asia. So this focuses on integrating mental health into primary care and community. The other study, of course, is PRIME. Of course, the authors are almost similar when it comes to the previous studies. So this was a research consortium that included quality improvement studies conducted in those 6 countries that I mentioned earlier, and aim to evaluate and strengthen mental health services through the implementation of district healthcare plans. And the other is, the SUSTAIN study that, of course, uses the quality improvement initiative aimed at improving mental health services in rural India, focusing on integrating mental health care into primary care settings and evaluating the effectiveness of this integrated approach. So these are some of the examples for the third type of implementation research method, that is quality improvement study. The fourth is, as most or some of you know, is participatory action research. Also, all research on human participants involves human participation. PAR assigns power and control over the research process to the participants themselves. And PAR refers to a range of research methods that typically involve iterative processes of reflection and action carried out with and by local rather than on them. So that means PAR implements a kind of bottom-up approaches that involve locally defined priorities and perspectives, as we may, explain more in the upcoming slides. And also, most of the PAR methods involve qualitative techniques. Increasingly, quantitative and mixed methods techniques are being used, as for example, in participatory role appraisal or in participatory statistics. So anyway, we'll discuss later. So these are the, the comparison between how participatory action research and implementation research differs from most conventional research. So as you see, in many domains, in terms of the research question, in terms of the scope, in terms of the target and the methodology or whatsoever, the center of participatory research action is or are the local people, all right, in terms of everything, and of course ownership of what is coming out of that particular study. So even you can see even the problem identification, interpretation itself, and everything is at the center of the local people, which of course is very interesting as opposed to the conventional research, but of course obviously is very intense and resource consuming, as most of you know, for obvious reason. So these are some of the examples, case studies that used participatory methods in mental health context in low-middle income countries. One of which is living with schizophrenia. So this study was conducted in India, and it used a PAR to involve patients, caregivers, and community members in identifying and addressing challenges faced by individuals with schizophrenia, and aim to improve mental health care and reduce stigma through community engagement. And user-led participatory action research in South Africa is another case study for this example. And of course, this study used participatory action, participatory action research to engage with youth living with HIV and disability in South Africa to identify and address mental health challenges they face, and to empower youth and to promote mental health advocacy. And the third type, of course, is empowerment. Empowerment and advocacy. And this study the intention was to train and empower community mental health workers, enhancing their skills in mindfulness and empathy, aiming to improve mental health care delivery and support for individuals in the community. So that's those are a few examples using PAR methods in implementation research. The third type is realistic review, and realistic review provides explanatory analysis focused on what works for whom, in what circumstances works, and in what respects and how it works. Those are interesting questions. And the aim here is to enable decision makers to reach a deeper understanding of the intervention and how its potential can be maximized in different settings. And it is an iterative process that involves sharpening the focus of questions around the nature of the intervention by assessing the integrity of the underlying theory, comparing rival theories, as well as assessing the same theory in different settings or contexts. So there is 6 empirical evidence in the literature that supports that may also contradict or even modify the underlying program assumptions, combining theoretical understanding and empirical evidence, while focusing on the relationship between the context in which the intervention is applied. And these are the real examples from widely cited and widely contextualized studies relevant to mental health context in similar settings or in our setups. So one of which is community mental health center intervention. So this is a realistic review, synthesized evidence on community mental health intervention in low-middle income countries, aiming to identify key contextual factors
and mechanisms that influence their effectiveness, focusing on understanding how and why these interventions work in these diverse settings. And the other is task sharing intervention for mental health in low middle income countries. And as you can see from the name, this realistic review explore task sharing interventions, that is, using non-specialist healthcare workers for training common mental disorders in low middle income countries to uncover the contextual factors and mechanisms that influence the successful implementation and outcomes of such interventions. And the third example here is mental health system strengthening in low middle income countries, of course, which is authored by same or similar authors for other studies that we saw in the previous slides. And this is a realistic review that examined mental health system governance in low middle income countries, focusing on identifying the contextual factors and the mechanisms that affect the effectiveness of governance strategies when it's related to mental health, providing insights into how governance can be strengthened to improve mental health services in those setups. The last kind, or the sixth type of study implementation research method would be mixed methods research. And of course, this uses both qualitative and quantitative methods of data collection analysis in the same study. And while not designed specifically for implementation research, as may you know, mixed methods research is particularly suitable for these research activities because it provides a practical way to understand multiple perspectives, different types of causal pathways, as well as multiple types of outcomes, all of which are common implementation settings. And a mixed method research schemes can be different, and of course can be used in different contexts on the basis of the emphasis of the study, the sampling scheme for the different components, the timing and sequencing of the qualitative and quantitative methods, and the level of mixing between the qualitative and the quantitative methods. And the uses may involve, of course, they are extremely useful and applicable for a range of purposes. This can be boiled down to like 4 main purposes, one of which is participant enrichment. To gain the most information from a sample of participants, for example, by administering a standard survey question and then asking for in-depth explanations, or it can be used for instrumental validity to make sure that the instruments used are appropriate and useful, including, for example, using FGDs to identify items for a questionnaire or testing its validity. It can also be used for implementation fidelity. So that is treatment integrity to assess whether the intervention or program is being administered as intended. And they also can be used for meaning enhancement to maximize the interpretation of the findings, such as by using qualitative measures to explain the statistical analysis or vice versa. And of course, there are so different mechanisms to report this mixed method research, be it in implementation research or in other aspects, of course, as relates to implementation research in particular. So there are guidances on the design, on the conduct and the reporting of mixed method designs. And a simple scheme for good reporting of a mixed method should, of course, answer some important questions, including describing the justification for using a mixed methods approach to address the research question, describing the design in terms of the purpose, priority, and sequence of methods, describing each method in terms of sampling, data collection, and analysis, and describing where the integration has occurred, how it has occurred, and how or who has participated in it, and describing any limitation derived from associating one method with another method, and of course describing any insights gained from mixing or integrating methods. So these are the components that we should consider mixed method research and implementation research as is relevant for mental health. And these are the real examples from literature, most of which are, of course, authored by same or similar authors in many countries. One of which is mixed method study on maternal depression in Ethiopia. Of course, this is not necessarily an implementation research, but it's really used mixed method research and used to demonstrate this method efficiently. So this study in Ethiopia used mixed methods to assess the prevalence and recognition of maternal mental disorders, combined quantitative surveys with qualitative interviews to provide a comprehensive understanding of the issue. And the other method, of course, the study that used this method was a study on depression in primary care in Pakistan. This study combined an RCT with a qualitative research to evaluate a psychosocial or a psychological intervention for depression in low-income women, and the research, the approach provided insights into both effectiveness and implementation issues. And the third one is mixed method study on mental health stigma in South Africa, and this study used mixed method to explore the impact of stigma on the mental health of people living with HIV/AIDS, and combined quantitative and qualitative example, methods. Yeah, as you can see, or as you have already seen, these methods are very strong methods and highly suitable methods that are being applied or used in implementation research in the context of mental health. And as you can see, most of them were published in high impact journals, including New Journal of England Medicine, Schizophrenia Bulletin, British Journal of Psychiatry. Of course, are published in two of those journals when it comes to mental health related publications so far, especially as is related to mental health research in the context of adversities in childhood maltreatment as well as adverse pregnancy outcomes. So what I'm trying to convey here is that these are strongest methodologies that are preferred or competitive to be published in high impact journals in the field beyond their contextual relevance for the real context implementation of any mental health intervention as we see fit. So as we design in general, and of course, as we summarize the types of implementation research methodologies used in mental health context and beyond, these are the few questions that we need to consider. One of which is that whether the research clearly aims to answer a question concerning implementation, whether it clearly identifies the primary audience, of course, whether it describes of what is being implemented and involve an implementation strategy and conducted in a real world setting as opposed to controlled setting, and whether there is a consideration of how implementation outcome variables were constructed and consider context and other factors and change over time and the level of complexity of the system that would direct the design for possible amendment as we go forward. So those are the basic questions that we need to consider during the designing process. In summary, I know this design should come after some slides, but I intentionally bring it here in order to summarize the designs or the study designs pertinent to implementation research in mental health. So, overall, we need to think of the outcomes as we also think of the design. So that means design follows outcomes. So basically in implementation research, be it in mental health or in other sectors or in other fields, these are the two categories of outcomes. One is implementation, the other is effectiveness outcome. So the implementation outcomes may include adoption, feasibility, implementation cost, appropriateness, fidelity, and coverage. In that case, we can use qualitative methods and descriptive statistics. And of course, this will also inform our design. And if our outcomes of interest are quality of life, symptoms or clinical events, and others, we need to consider observational and experimental designs as we try to design our methodology for implementation. So with this, we will move to implementation strategies. And implementation strategies often focus on the strategies needed to deliver or implement new interventions, which are referred to as implementation strategies collectively, which of course this term is a term used to distinguish them from clinical and public health interventions. For example, while mental health awareness campaigns and programs for healthcare providers are implementation strategies commonly used to improve the reach and effectiveness of mental health services, the provision of therapy or medication itself is considered the health intervention. I think that should be clear at this very point of this webinar. So implementation research may focus on the implementation strategy itself or incorporate consideration of the implementation strategy into a broader study of the implementation intervention. That is critical. And once again, as we have said, implementation strategies could be grouped in terms of the actor or stakeholder. So if the government is the stakeholder or the implementing or provider organization is the stakeholder or the actor, I mean, the strategy would be different depending on those context and factors. That is something we need to know and we need to contextualize. So how should implementation research be conducted? Of course, this would relate to one of the slides that I projected earlier as we see the steps of conducting implementation research. And of course, I brought it intentionally because it needs to mimic your understanding or your thinking first as we delve deeper into the next slides regarding the mechanics of implementation research and how it should be conducted. So implementation research should be aligned with need. There is no question in that, both in the sense that it meets the requirements of the intended audience and is also responsive to the particularities of the subject under study. That means we need to be responsive to the demands of our subject and of course our audience. And importance of flexibility and responsiveness in implementation research is also under consideration. So both health systems and its actors are constantly changing and adapting to new actions, often reacting in unpredictable ways. And contextual factors can influence implementation, and these factors can also change over time, producing predictable, unpredictable effects that require continuous adaptation for implementers. So research designs need to be responsive and capable of capturing these changing elements at multiple points in time. That is critical. And if that is the how, who should be involved in implementation research? Of course, we have discussed that in detail in earlier session, but it would be good also to discuss it because implementation research should be aligned. One of the main defining aspects of implementation research is that it seeks to understand the reality of implementation in real-world context. And unlike other forms of research, it does not seek to filter out the extraneous or the accidental or the outlier. Indeed, in many ways, it is precisely such factors that are of interest to the implementation research. This is very clear. And the consideration, of course, very important. And the considerations of context that are relevant to implementation research are also, of course, would be illustrated in upcoming sessions. So during the pre-implementation phase of an implementation research project, all contextual factors should be analyzed. We know they would be changing as time goes on, but we need to analyze as much as possible. It should be also noted that these factors vary considerably from one location to another and from one project to the next, and of course from one step to the next. And understanding of context and systems and the flexibility to identify appropriate methodological approaches can be as important as, or even more important than, adherence to a fixed research design. I think that's very clear. And this was the slide I was talking, all right? As we design, who should be involved in implementation research, there are many sectors and, of course, many interrelated factors and functions that need to be considered while considering contextual factors. So the political, the physical, the cultural, social economic or socio-economic stakeholders, system, health system level, institutional, and other X factors should be well considered, well examined at the pre-implementation stage of an implementation research, especially in the context of mental health research. So successful implementation research begins and ends with successful collaboration. There is no question about that. So good implementation research is a collaborative research, and often most useful where implementers have played a part in the implementation, the identification, design, and conduct phases of the research undertaken, and the fostering of collaborative ties between key stakeholders involved in policy generation, program management, and the research is very essential. And the importance of both researchers and implementers coming together in the conduct of implementation research is of considerable importance in situations where the core issues related to quality improvement and the scale up of a program, both of which impact many stakeholders. And a symbiotic relationship is very, very important. A relationship in which implementers generate feedback from the front lines, while researchers provide expertise in research methods, is needed for trustworthy studies, and of course, build that process, that iterative process that we saw in one of our earlier slides. So that is critical. At this very point, it would be nice, of course, how that would be challenging in the sense or in the spirit of collaboration. So collaborative approach in general are very challenging and present a number of opportunities for implementation research, but obviously they are very challenging. And this is partly a reflection of the complexity of health systems, the environment itself, and the way that multiplicity of actors working within them interact. So the ecology really is very important. And another challenge inherent in collaboration is the competing priorities of the stakeholders. For example, researchers may be under pressure to publish high-impact journals or in high-impact journals that often favor a specific disciplinary approach, while implementers may not be under pressure or may be under pressure to resolve the problem in the shortest time possible. And one way for implementation researchers to improve the chances of successful collaboration with partners in the field is by getting out into the field. It is very critical. And funders are frequently resistant to implementation research that might highlight sustainability issues or the negative and unintended consequences of the program, such as the human resource distribution problems arising as a result of hiring people for single purpose projects, an issue often encountered with public health projects, which may include mental health ones. So those are some of the challenges that we need to foresee as we try to design, of course, implementation research in mental health landscape. So how can implementation research can be embedded in the overall design, planning, and decision making? So we neutralize some of those challenges that we discussed earlier. One way to improve collaboration and encourage partnerships in implementation research is to integrate it into policy and the program decision making. Because implementation research often allows from well-established program activity. Of course, it follows from well-established program activities and is of direct benefit to programs, and makes sense to include it as an integral part of program processes. from the beginning rather than at a tangential activity. That is critical. And of course, that is why one or more of those study designs that we explicitly discuss are very relevant. And implementation research needs to be embedded in the overall design, planning, and decision-making activities, and it can be achieved in a number of ways. One of which is integrating funding into research and program activities. As you know, research funding generally flows through separate channels from program funding. As a result of this separation, research funding cycles are not always aligned with program needs. And similarly, a good deal of research is awarded on a competitive basis, whereas program funding typically is not competitive. So these two create mismatches between program needs and research activities. So integrating funding into research and program activities is one mechanism. The other is a systematic application of research and scientific inquiry in program activities. And this systematic approach or application of scientific research should be institutionalized within program decision-making so that implementation research becomes a core part of the problem-solving processes. And for example, the WHO Expand Net framework for scale-up is a useful example of how research and the scientific inquiry can be integrated into processes. Of course, I provided the link to that in upcoming slides for you further reading in your next, during your next 4 weeks. And this framework includes questions that need to be answered, sometimes through implementation research as part of the 9 steps that implementers need to be considered when scaling up a program according to this framework. And another way in which research and scientific inquiry can be, of course, integrated into program decision-making through mandatory monitoring and evaluation. So this helps to identify problems and challenges on a regular basis, some of which may be addressed through implementation research. And the third and the final way, of course, is shared responsibility for decision-making. So implementers and researchers often come at the problems from slightly different angles. So that means implementers focusing on the specific barriers and challenges to implementation, whereas researchers looking for ways to formulate questions that are suitable for study and can be answered through research. So decisions about study designs, methods, and outcomes need to be informed not just by the perspectives of the researchers, but must also reflect the views of implementers and other stakeholders. So these questions that the subject of implementation research need in many cases to be jointly developed by researchers and decision makers to reflect their different perspectives. And the fact is sharing responsibility for decision making is not always easy, as you know, nor will every decision be agreed upon by all. However, it does show that decisions can be informed by multiple perspectives and that the expertise and insights of different actors can be given due consideration. So that is, I think, understandable. So now, of course, the importance of research question and implementation research is very critical in one way or another way to encounter the above challenges. So as we have said, in implementation research, the question is king. Of course, it's a king in every study, and that is a question that determines the methods used rather than the method that determines the kind of questions asked. And the questions asked are often complex, reflecting the complexity of the real world. A wide array of contextual factors influence implementation, producing unpredictable effects that require continuous adaptation by implementers. So, given the importance of the research question, it's quite useful to consider the kinds of questions that are likely to arise and the research method that may be appropriate to answering them. So one way of going about this is to break down research questions into a limited number of categories based on the core objectives of the research to be undertaken. So that really is important. And at this very point, implementation research outcome variable and defining the same is very important. So these implementation research outcomes really describe the intentional actions to deliver services. Of course, by now we know the intention of implementation research. And of course, this also serve as indicators of how well a given implementation is actually working, useful for measuring success further of an implementation. So in general, the 8 implementation outcome variables that we saw earlier in that table, if you remember in the summary table, acceptability, adoption, appropriateness, feasibility, fidelity, implementation cost, coverage, and sustainability under 2 categories, under implementation and effectiveness, can also be seen as intermediate factors that contribute to other important outcomes, such as satisfaction with healthcare or health status. And that really is critical. And of course, interestingly, these 2 slides would give you a very preliminary understanding of what those implementation outcomes would look like, what is their working definition, what are other related terms in the language of implementation research, and blah, blah. Of course, I will not go through the details of this, but to pick 1 or 2, for example, acceptability, if the implementation outcome is acceptability, the definition, of course, here is that, of course, the working definition would be perception among stakeholders, for example, consumers or providers, consumers in essence, mental health patients or customers, providers or physicians or nurses, managers, policymakers, that an intervention is agreeable, that the working definition, and of course, these are the related terms. Acceptability, I mean, comfort, relative advantage, credibility, and others. And of course, to pick another important term related to implementation outcome and to see its working definition is that fidelity. This is the extent or the degree to which an intervention was implemented as it was designed in an original protocol or plan or policy. So this would be related to terms like adherence, delivery as intended, integrity, or we call it mostly treatment integrity, quality of program delivery, intensity or dosage of delivery whatsoever. Anyway, those are very important 8 outcomes in the implementation research, or we collectively call them implementation research outcomes, outcome variables, sorry. And another important takeaway here is that these variables or these outcome variables appear or tend to appear at all stages of implementation research. So they may occur at the early implementation stage. They could happen or will be used to mid implementation at mid implementation stage, could be used at the late implementation stage throughout. So of course, modification, adaptation, and those temporal changes, of course, should be relevant and considered as a defining criteria for implementation research. As we try to summarize this subsection, not all section, it would be very critical to see 3 key phases in implementation research. One of which, of course, is defining the implementation problem phase, that is phase 1. And this, of course, is very important to investigate the implementation problem, taking into account setting and context. Let me repeat, setting and context, and identifying reasons for the problem and generate information on possible solutions via stakeholder engagement. And the second phase is called phase 2, that is designing implementation stage. And this stage brainstorms on possible solutions based on phase 1 data and the relevant scientific literature, and used to design improved implementation strategies that have the potential to overcome them in this type of setting. And the third is phase 3, testing implementation strategies, which tests new implementation strategies in real-life settings, and which assesses implementation outcomes to determine implementation effectiveness and compare implementation effectiveness of new and old strategies. So those are the key phases in one slide. Of course, speaking to the many slides that we have been discussing in a previous session. So Good implementation research should be able to address some or all, of course, each of those questions. So will the research answer a relevant and important implementation problem? Is the new knowledge potentially worth the cost of the research itself? Are there clear research objectives and questions related to implementation and the does? I mean, does and I mean, the proposed research design match them? And does the research fit within a theory of change or causal chain in a coherent way? If not, what is the potential for generating new theories or questions? Will the research produce results that can be acted on in a timely way by the intended audiences? That the research design reflect on understanding about whether the intervention is stable and simply replicable, whether the intervention is expected to change, and of course it should show adequately capture changes that occur over time and place, and considering the intervention, the context, and the effects. And of course, it should consider the complex environments that can the implementation identify the main component of the research system and their relationships, as well as the unintended consequences that are likely to occur from intervention. That really is very important. So with this that summary, we'll be just rushing through three interrelated topics, that is evidence translation, evidence dissemination, and scale up. And so it's very important to see this this flow diagram. Let me call it a flow diagram. So there is a pre-intervention phase here where which will start with efficacy or explanatory studies, feeding to effectiveness or pragmatic studies, one or collectively feeding to the implementation phase and implementation studies in terms of those important outcomes, adaptation, and other aspects, of course, linked by exploration. And the cycle is continuous in this regard. So as we try to translate evidence from implementation research to solve the implementation problem, we need to consider this vicious cycle. So how can the potential implementation implementation research be realized and effectively translated into practice? So despite the importance of implementation research, it continues to be a neglected field of study for two reasons, as I've tried to highlight at some point earlier. One is for lack of understanding regarding what it is and what it has to offer. And of course, the importance of this webinar is in that context, majorly. And the other is lack of funding for implementation research activities. And without implementation research, however, we are at best committing valuable resources to implementation in the hope that things will work out. Implementation research is not on the whole an expensive pursuit. So investments in it go a long way. And we now have many of the interventions and technologies need to reduce morbidity and mortality and should focus more on making better use of them. So more opportunities for researchers and implementers in low middle income countries, especially who want to undertake implementation research, are needed. So one of the potential in realizing implementation research would lie in that. And how can the potential of this realize? Of course, there are so many agendas for action to support and promote implementation research. One of which would be implementation research should be seen as a core part of the program implementation. And another should be it becomes more accessible, especially in terms of research should be encouraged to engage in program activities. The third action point should be implementers need to make programs more accessible to researchers and invite researchers to participate in programs. And the fourth one is making more funding available for implementation research, as said earlier. And another is more training opportunities like this should be offered and should be available for researchers and implementers, and provide more guidance and opportunities for mentorship like this and others. And incentives should also be there, especially linked to engaging in making changes in policies and programs. So these are some of the mechanisms that we need to involve if we need implementation research would be realized and translated into evidence, into practice as intended and as its main core concept, purpose. So the next one is dissemination of mental health research. As we have said, dissemination of mental health research involves sharing findings and knowledge with relevant stakeholders, policymakers, practitioners, and the public to inform practice, policy, and further research. And there are several critical issues that we need to consider to effectively disseminate mental health research. And one of which is target audience, identifying key stakeholders, including policymakers, practitioners, researchers, and the public who will benefit from the research finding. And another is message tailoring, or tailoring message to the context to meet the needs and the preferences of different audiences to increase relevance and engagement. And the other, of course, is the issue of language and accessibility as related to the cultural sensitivity. So ensuring findings are very communicated in a clear, non-technical language and language sensitive way or format is very important to different stakeholders or audiences in terms of summaries, infographics, and whatsoever as we need, as we see fit. So the other, of course, is the channel. Channel should also be, very tailored for our specific audiences. And of course, culture is related to the language, and ethical consideration should also be there. So findings are disseminated in an ethical way with attention to confidentiality, privacy, and consent. And the most important aspect is sustainability and impact. So plan for the long-term dissemination and sustainability of research findings to maximize impact and uptake should be at the center of dissemination of implementation research for mental health. And of course, typically there are frameworks for dissemination in implementation research, generally for implementation research, and of course that can be used for mental health research. One of which is RE-AIM framework, focusing on reach, effectiveness, adoption, implementation, and maintenance, which provides a systematic approach to plan and evaluate the dissemination and implementation of health interventions. And then another one is knowledge to action framework. This is a framework used for the translation of knowledge into practice, emphasizing the iterative process of knowledge creation, synthesis, and application. And the other is consolidated framework for implementation research, providing comprehensive list of constructs that influence implementation, including dissemination strategies, organizational factors, and individual characteristics. And the other is PRISM. This framework focuses on practical strategies for implementing and disseminating evidence-based practices in implementation research in healthcare settings. Those are some of the frameworks for maximizing dissemination of mental health research in implementation research. So when we come to implementation, scaling up of mental health intervention, of course, the previous efforts are obviously for scaling up of mental health interventions, and they are interrelated in one way or another way. So after all those processes that we have discussed in the implementation process, research, let's now assume that implementation research was already implemented and the implementation findings are here. So it needs to be implemented or disseminated and advocated for key stakeholders. Here, it may also at some point after dissemination would be, tailored to be included in national strategic plans or policy adoptions at macro level, and implementation may be scaled up. And monitoring and evaluation goes on. And interestingly, upon continuous implementation, new implementation research questions may arise as a function of the continuous interaction between implementers, researchers, and other key actors as we have discussed, which are the key elements or subsets of implementation research, and of course, in formulating and designing, of course, implementation research. So these are some of the key guidelines for you to consider for your next 4 weeks for reading. Therefore, they are fairly available in the WHO website for your further reading, especially when we consider on the frameworks of scaling up implementation research, including mental health interventions in our setups. That is for your further reading. Of course, the links are also provided. And as we have said, the scaling up, even though this guide will guide you, at the center of each guideline is evaluation and monitoring as a scaling up tool. So good monitoring and evaluation is critical in early phases to detect and resolve problems in the scale up, and in later phases it's important to ensure effective delivery is maintained. So methods of monitoring may themselves need some research to develop appropriate tools, obviously, but part and parcel of this process. So these are some of the key considerations for scale up of mental health interventions. And of course, these are summarized from the previous references that I've showed you. So one is contextual adaptation, tailored interventions to fit the local, cultural, social, and economic context to enhance accessibility and effectiveness. And the other is partnership and collaboration, building partnership with stakeholders, including government agencies, community organizations, and healthcare providers to facilitate scaling up efforts, and sustainability planning to develop strategies to ensure the long-term sustainability of the intervention beyond initial funding and support, monitoring and evaluation, as I've said already, scalability assessment, that is, of course, feasibility and scalability assessment, determining readiness and potential challenges, and policy and advocacy to support the scaling up of the mental health intervention at the center. And of course, as we have said, these are the cross-cutting, of course, overlapping frameworks as used for dissemination. And of course, they are used for scaling up mental health intervention as well. And you can read them for further understanding and how they are related to the other elements of implementation research, which would include evidence translation as well as dissemination. With that, interestingly, we are at the, I think, according to our course outline, we are at the end of the subtopic, or the last subtopic, of course, which looks into the economics of mental health. Of course, I will not be leading or taking you to the models of health economics or economics to predict economics of mental health. They would be part and parcel of your other courses I've already tried to highlight at the beginning. So the economics of mental health explores the financial impact of mental health issues and the cost effectiveness of mental health care. The field is crucial for shaping policies and improving healthcare systems to better understand mental health needs. So it may consider direct costs related to medical expenses for treatment, including medication, hospital stays, and psychiatric consultations in the context of mental health. And of course, in one of the literature that I was reading at some point, treating depression can cost up to, 1,000 USD annually per patient, as compared to many other physical ailments or illnesses. And indirect costs cover lost productivity, absenteeism in the workplace. And for example, in that same literature, untreated anxiety can result in productivity losses amounting to like $4 billion USD in the US itself. So the economic cost of mental health is very enormous. Very huge. And these are the 5 ways of thinking economics of mental health. So the political economy and the globalization in the context of mental health and its economic impact. the economy and its impact on people's life, of course, considering the wider determinants and behaviors, and the direct public health services costs for poor mental health, and investing, the wider costs for mental health service itself, and costing in better public health intervention, better health, and investing in public mental health, and in this context, of course, it would be also appropriate more implications in terms of broader economic impact. As you know, mental health issues can affect not only individuals, but also their families, communities, and the national economies. For example, schizophrenia can lead to significant financial strain on families, often resulting in lost income and increased healthcare costs. And poor mental health and well-being have also consequences for workplaces and other environments. Of course, they do have ecological consequences. And of course, this is a graph that I borrowed from a given literature PowerPoint from one of my previous interactions on this topic. Of course, this relates to the impact of the mental health condition as it relates to the economic impact, lost opportunities for innovation and creativity, absenteeism, staff turnover, adverse effects on working conditions with colleagues, increased conflict in the workplace, stigma and discrimination in the workplace, increase in the risk of poor physical health and injuries, and so on. And for example, this is a graph that I borrowed from German data. So in 2015 alone, depression, anxiety, and stress costed Germany's health insurance fund up to 209% times, as compared to 21% for all health problems. That is of almost more than or equal to 10 times more effect as compared to all health problems. So that really is critical, and of course it is similar, even though there is no study, it is a similar context, or it would be the same context in our context as well. So the major economic context is, of course, in the whole Euro region. For example, from mood disorders in 2017, in 2011, the whole Euro region lost around or more than 100 billion euros for mood disorders, accounting for healthcare, other services, and productivity loss. So that is critical, of course, and it may showcase the effect in low-middle-income countries as well. Now, from some statistical data, according to WHO, mental health disorders will cost the global economy $16 billion by 2030. And GBD, as you know, global disease burden, estimated that about 418 million disability-adjusted life years could be attributable to mental disorders in 2019. That is 16% of global deaths, imagine, and a more than threefold increase compared to conventional estimates. So the economic value associated with this burden is estimated at about $5 trillion, and at a national, or at a regional level, the losses could account for between 4% of gross domestic product in Eastern Sub-Saharan Africa and 8% in high-income North America. So, the economic cost really is very immense. So what needs to be done? That's a critical question that we need to ask at this very point as you try to align your data price for this initiative. So, of course, there are key questions we would be considering. Where would you or we invest to improve mental health and well-being and reduce the costs? What would a good investment look like in terms of certainty, in terms of time scales, alternatives? Would it be economically better, for example, to invest more in preventing loneliness or in early intervention in psychosis? Or what about early intervention to minimize like other predisposing conditions, including childhood distresses or adverse capacities in relation to improved mental health and physical health in later life, and how would we do or we know it? So anyway, these and other questions could be the guiding questions for this basic question. So evaluating interventions would be one of it. So it's important to compare the outcomes and costs of different mental health treatments to determine the most effective use of resources. For example, cognitive behavioral therapy for anxiety disorders is more cost effective compared to medication, with long-term benefits and, of course, fewer side effects, as you know. And healthcare economic models would also be involved while answering this question. So models such as quality adjusted life years help predict the long-term benefits and the cost for treatment. And of course, in the meantime, for advocacy purposes for decision makers. So early intervention in psychosis can save up to 18K, for example, 18,000 USD per patient by reducing hospital admission and improving recovery from outcomes, according to my reading. And disparity in access should also be considered. So here there are significant inequities in mental health services availability across different populations and regions. So for example, rural areas often have limited access to mental health services compared to urban areas, leading to untreated mental health conditions and their consequences. Another issue we need to consider is strategies for implement, which of course is at the center of implementation science or research. So policies and the programs are needed to ensure equitable access to mental health care for all populations. And for example, telemedicine or AI initiatives are proven successful in providing mental health services to underserved communities, reducing travel time and costs, blah, blah. And another thing we need to consider is, of course, importance of continued research. So ongoing research is needed to refine our understanding of the economic aspects of mental health, and of course, other aspects to develop effective policies. And finally, call for action or call to action for stakeholders so that they invest in mental health care improvements to ensure a healthier, more productive society at large that contributes for, the economy of the whole community or the whole nation. So as we conclude, it would be nice to have some take-home pointers for overall session. One is implementation research attempts to overcome gaps in care, bridging what we know and what we do, as we have said. And there are numerous strategies to overcome these gaps directed at patients, physicians, organizations or society. The first step in choosing an appropriate intervention design, as we have said, is to identify what outcomes are most important to capture. And the implementation research outcomes are constructs describing effects of a deliberate and purposive action to implement an intervention. The use to measure success or failure of an implementation activity or strategy or health system readiness. And another thing is that no silver bullets, therefore how to use strategies or sequentially to optimize use and effects, and using one of those appropriate study designs of implementation research. And most things in clinical and public health practice are try something and then try something else in those who do not respond or succeed. So we can't do everything at once, and that really is critical. So repeating or looking for alternatives is mandatory. And implementation research addresses proven health interventions that do not have the expected outcomes because of implementation problems, and new efficacious health interventions for which major implementation problems are anticipated. That's critical and is very clear at this stage, I hope. And implementation research identifies and investigates problems that prevent effective implementation of the intervention, and of course, it develops and tests implementation strategies that provide solutions to those implementation problems. And the focus of implementation research is on finding evidence-based solutions, as we try to introduce at the beginning. So in general, those are the key, the take-home points. And thank you so much for your attendance. Of course, these are the references. And I can see about 48 people still consistently attending our webinar. That, of course, is a good number, even though it's much less than the anticipated number based on our training needs assessment, which is, of course, about 90 or 89 or 88% of individuals showed their interest in evidence-based practice, of course, via implementation research. So that is from my end. Thank you so much. And over to you, Chair.
Thank you very much, Dr. Manuel. That was quite a very interesting debate, and thank you for addressing the various issues, even regarding the issue of scaling up for mental health interventions. So we will be sharing definitely the recording of this. So I see some are asking for it on our platform as well as on our YouTube channel. I would ask if a member of Mauricio maybe to make the last remark, closing remark, or if we have questions first. I didn't see questions. This one was more of a comment. There was a comment from Rashid Raji that IR is great. The challenge is policymaker perception of efficacy, EBP and intervention. Politicians and policymakers in Africa have negative attitudes towards evidence-based interventions. So I think that's a comment. I didn't see any other questions. So unless maybe we have a questions, I can allow you to ask a question before our facilitator. Yes, Priska, go ahead.
Hello, I have a question about some of the last remarks on the last slide. There was a statement that said that it's estimated that mental health will be costing the global economies about $16 trillion by 2030. So that is a pandemic from what I see. What does that mean for our employment, like people in employment, and also for our government? Are people turning a deaf ear to the mental health issues that are coming up? Or why is that cost estimated in that manner? Where is it coming from? Because it is quite alarming.
Yeah, thank you so much, Priska, for that a good question. Of course, yeah, that was a WHO estimate, considering, as you have said, many variables and factors, including the direct, indirect costs on health, and also the productivity cost at the individual level, at the community level, of course, contributing to the whole nation, and of course to the global economy. So as you have said, of course, mental health is underrepresented topic, not only in low middle income countries, but also in other high income countries somehow, even though, I mean, the comparability wouldn't work because the high income country part has gone a little higher in terms of investment for mental health. So as one of the comments say, I mean, already, reflected the low uptake of implementation research, especially in policymakers and their resistance whatsoever, of course, as we have said in many instances, from low awareness, which may be, associated with other factors that would be an alarming and would need some sort of intervention to to mitigate that foreseen consequence to the global economy. And for your surprise, that the consequence of mental health, the mental health consequence on the economy, on the global economy, much of that is expected to come from developing countries, as they call it. And that means we need to try our best at all levels, of course, to create the awareness, the investment as much as we can. Of course, also investing on oneself or ourselves in a feasible manner for avoiding or mitigating mental health disorders that would be contributing for economic loss. So that would be my reflection. Generally, I agree that the term that you used, pandemic, is really that would apply for this context as well, is a pandemic in terms of that massive level of economic cost for the global economy. Once, even though the affected regions are still continue to be affected immensely by the consequences of mental health. So that would be my just reflection, and others can add on that so that we make it open engagement, because as it is the concern for individuals. Over.
Okay, thank you very much. Do we have any other questions? Feel free to even write it on the chat. Okay, then if we don't have any other questions, I would like also to remind you that starting on Tuesday, 18th June to 21st June, we'll be having the course on statistical model for mental health. And this will be offered by Dr. Samuel Idi. So stay tuned. We will be communicating and sharing the details on the course. So that will be a continuous course, learning from 18th to 21st. So unless we have any other question, would like to thank you, Dr. Emmanuel, for the wonderful training. Yes, go ahead.
Thank you so much. There is a question, one question from Susan.
Okay.
On the chat box. So she was asking whether one should be or should have a PhD to be a PI in an implementation research. The answer is a yes and no, depending on the scheme of the call. So if the open call that you are targeting is, considers having a PhD as a requirement, the answer is yes. Otherwise, is not a mandatory requirement generally in research. So that would be just my simple reflection. Otherwise, back to you, Joel, and thank you so much for your reflection.
Thank you very much. And in light to that, for the mental health data prize applications, you also don't need to be a PI, to have a PhD to be a PI. I think we had talked something like that before. And thank you very much, Dr. Emmanuel. This was wonderful, and for taking time to take us through this course. I will definitely share the materials with everyone on our platform and share this recording on our YouTube channel, so that even for those who are not maybe able to join, can be able to definitely get a share from it. Okay, thank you very much, and have a good afternoon, everyone.
Thank you. Bye.
Bye-bye.
Thank you, Joel.
Thank you. Goodbye.